Mike, thanks for being here, buddy.
Thanks
Appreciate
for
you
having
coming
me.
on. So, everybody watching, we met through, I believe, Talia's cousin Matt, right?
Correct.
A few years back. Got to know you a little bit through our old gym, right? Really enjoyed just getting to know you in this time, and then at some point decided you want to come into the fountain and into Encore and kind of do some different things. So, love you to give us a little background, just on you. What do you do? You know, where you? I know you moved down here recently, so give us a quick little 2 minutes on you.
Sure. Well, thanks for having me. And thanks for hearing my story. I know time is super important to people, so giving me your time is very valuable. We came down to Florida 5 or 6 years ago from New York. Like many people, we kind of felt like we were chased down during the pandemic,
Yeah,
and we came and we started putting roots down, and our extended family came as well, and little by little we kind of settled here. And for me, this is home now. Um, the time we spend in Florida grows every year. Our kids are in school. We're part of the community here, and we really love it.
it's awesome, man. We're super happy to have you down here. And, my wife's from New York and
Mhm.
obviously her family as well. So I have an affinity for New Yorkers, especially even growing up down here, I still do. So it's great.
Oh, we have a few good qualities, despite what a lot of people say.
Yeah, you guys aren't so bad. So what made you, at some point, right? We met through the
Hmm.
gym,
Hmm.
and then we opened the Fountain and Encore a few years back, and you decided to come in, and it's kind of been interesting to watch from my side of you kind of growing with us, right? Came in early on and then have slowly done more and more diagnostics. So walk us through maybe the initial interest and why you came in and first step foot in the fountain.
Great. Um, from the minute you told me about this new concept you had in this business you were opening, I was interested in it. I was wanting to be supportive of you and learn about what you were doing. When I finally kind of scratched the surface of understanding it, I realized, okay, this could be something really good for me.
Yeah.
Supporting your friend, but also helping myself. So what happened around that was mostly a little bit ego driven in the beginning. Was I was trying to find better ways to perform in life and trying to find ways to improve myself. And that evolved. And the way I kind of got to wanting to go much deeper was, I think, fear at some
Mhm.
point. Some health issues around family members close to me in similar ages.
Mhm.
I started saying to myself, okay, well, rather than just trying to perform better and look better and those type of things, like you should really try to see what's under the hood and learn more about the machine that is yours. And this body, this vessel is all we have, right?
Yeah.
So trying to take good care of it. So that's when I wanted to go deeper in learning, and potentially finding anything in an early stage if there was anything alarming. And that was what kind of piqued my interest in wanting to do more and learn more.
It's awesome. Do you mind sharing with the listeners what all diagnostics you've done with us?
It's a great question. I've probably done more than I can remember or list, but I've done just about everything. I've done all the different type of blood work, all of the kind of food related,
Hmm.
allergy testing, all that kind of stuff. I'd done the full body scan,
Hmm.
which I had a wonderful experience with. I had done a different scan in the past, a couple years earlier, the Prenuvo scan.
Yeah.
So that kind of got me interested in learning about finding things out early and being preventative. Um, and the more recent ones, it's evolved a bit. It's kind of faster. It's more detailed. And so that was going through the results of that body scan with a doctor was kind of something that was interesting to me.
I think what's always fascinating to me and what we've really started to build our business around, I think what would be interesting for people watching this is people's personal story. So your personal story, right? You shared with me what happened with your sister
Hmm.
and you've been there with you kind of through a lot of the stuff that's going on. How is that? You mind sharing her story, right? I'd love to hear that first and foremost.
Yeah,
And then
sure.
kind of tell us how that's motivated you to be more proactive about your health.
Um, I think it goes back further than that. I lost my dad at a young age. For him, relatively speaking, my old man was 55 when he passed, and the lineage on my paternal side of my family is that the history is that most of the men don't make it till they don't die of old age, so to speak.
Yeah.
A lot of heart disease, cardiovascular issues, cardiac problems, but mostly connected to high blood pressure, high cholesterol, things like that. And so my dad's side of the family, including my brother, have had heart issues. heart attacks, stuff like that. So that was something we were always careful of from a young age. We were kind of asked to be doing echocardiograms as annually since we were kids, and that evolved into just kind of learning, like, okay, fortunately, I didn't have a lot of the kind of bad side of inheriting some of those bad genetics.
Yeah.
So I typically had lower cholesterol and lower blood pressure, and didn't have like a big struggle with weight my whole life or any of those type of things. So, but it was always still there. So it was always trying to stay in front of that and being careful of those type of things. And checking more frequently than kids should, as far as like blood work, cholesterol, stuff like that.
Yeah. I can't think of a time I was doing an EKG before I hit my 20s, you know?
Yeah.
Yeah.
That stuff was originally to be preventative. About 18 years ago, my sister was diagnosed in her late 20s with breast cancer, and she had a long, hard fight, and she was amazing. She had kind of reoccurrence many times over the years. She'd go into remission, and then something else would come up a few years later, and so on. And that kind of was a little bit of a repetitive theme until the end of 2024, December of 24. The breast cancer evolved into becoming metastatic breast cancer, and that was ultimately when it started to morph and change and show up in other parts of her body, and she ended up succumbing to a terrible disease earlier this year.
Yeah. And it's I can't imagine. Right?
Yeah.
Like, it's there's no words for it, and it's ultimately, you know, why we do what we do. We want to help people and hopefully prevent things like that from happening. And there's 1,000 different ways you can do it. So my question for you is, like, let's think about talking about your sister specifically, right? It seems to have kind of reignited a fire for you in terms of getting in front of your health, right? And how would you say things have changed for you since your sister passed in terms of your health?
It's a great question. I think that I'm generally more sensitive to things and paying attention a little bit more. I've probably always been that way, but I've never really taken it as seriously. But kind of a personal wellness journey for me always kind of amps up around tragedy and hard times in life.
That's human nature, right? I think we're all
susceptible to that. I'd like to believe I'm a little bit more evolved now at a later age, and I can talk and communicate things rather than have to run 20 or 50 miles to get some stuff out.
Yeah.
But fitness and wellness has typically been my outlet to dealing with things.
Love that.
And so this time, instead of just kind of like logging miles and pounding my body physically, I was like, this is an opportunity to look deeper in other ways and be more thoughtful and more intelligent about it, especially with all the things out there that exist to help. And so a place like yours is a perfect example of a way I can start to find out more about myself and, learn. I always say we don't know what we don't know. So the more we can find out and learn, the more we can solve problems and do things.
Yeah. And we're big on that same modality or mentality, of course, right? Like information is critical, but there is a certain point, right, where we start getting a lot of information. I think you're kind of at that place now, having done, I know the list off the top of my head, so yeah. I'll list it out. Full body MRI, functional DNA, biological age, which also includes pace of aging, all the advanced blood work, and then nutritional sensitivity. Put all those together, you have almost 800 pages of diagnostic data, right? And you've seen under our roof multiple providers and physicians for physician review for body view, provider review for this and that. And what I'm curious about is where you're at now, right? With all that information, like what has been, I guess, walk me through the experience first of kind of like, you've done all these different diagnostics, right? And emotionally, mentally, where has that left you? Because some people will come in and do all these in like a day, right? And then they get the results back over a couple weeks, but we've been together for a couple of years on this journey and we've kind of pieced it together piece by piece. But now that we kind of have the full picture, describe to me the journey emotionally for you.
Well, it's a process, right? It's I wouldn't have committed to doing it if I wasn't all in. And I'm kind of like that in life. I'd rather not do something at all than do it kind of halfway or only a little bit, especially when I know there's so much opportunity within something. So I waited till I was kind of more ready to dive in with this, to really go in. So the experience for me has been great once I kind of committed to it and like became a little more open-minded to learning. And that's how I am. I typically resist things until I want to make a change.
No, I get it. So you have all this diagnostic
Yeah.
data,
Yeah.
right? And we've certainly made a lot of recommendations from lifestyle, dietary, supplement, therapeutic intervention, right? And because we're looking at the body through multiple different ways, and because we have multiple physicians and providers reviewing those different reports with you, because one provider is not necessarily the right person to review a different diagnostic with you, you got a lot of information, right? And sometimes conflicting priorities. What's confusing to you still? Take your time.
There isn't any major part of this that's confusing to me. I think that there's a lot of data, and I think that it's important to dissect and pull out of there what's important to you, and then lean into that. For me, anyway. And then lean into those things. So for me, historically, it's been more kind of performance and vanity driven in my 20s and my 30s. Now, it's much more important with how I feel and how I like operate and perform in life, like my energy, my mental state. But there's also something where all of this kind of health and wellness and fitness, it's all part of, for me, like this bigger like spiritual journey that we're all on, where it's like it all has to come together and clicking. And I think right now for me, it's all kind of working in harmony rather than there being friction between how I'm behaving in life versus how I'm attending to my fitness and then my family and wellness and all these other things. So I think for the first time, it's all in alignment.
Which is great, right? And we're huge advocates for alignment of the vessel and the spirit, right? Because the vessel is where it starts. And so I know that your wife has met my friend Daniel, and I think I've introduced you to him as well. And he's big into he has a couple psychedelic therapy facilities and very spiritually based. And we talked about, right, like for bodies, the vessel is part of the foundation, right? You can kind of start from it either ways, like start with the spirit or start with the body, in my opinion. But to really achieve that alignment with greater power, right?
Yeah.
Like requires kind of both. Would you agree with that?
I do. I'm also in a place now where I think I'm a little bit more intuitive, where I'm listening to my body more instead of just forcing it to do things because this is the plan I'm on, this is the path I'm on, or these are the rules I've set for myself.
Sure.
Where listening to my intuition a little more in my gut with what's working and not, in addition to connecting that with all the data, right?
Yeah. That's important because that's how we look at it too. And I think I've had a few concierge physicians in here today, and they've said the same thing. Like, it's not just chasing numbers, right? Like you could have a patient who their cortisol, for example, is great, but they feel stressed out and they feel terrible. It's like, well, that's not a good indication of what's actually going on. Maybe there's something else going on, but we need to pay attention to how the person's feeling as well.
Yeah. And I think that comes with patience and age sometimes, and almost, and being ready, and trusting in yourself in that process. Like you want to get to a point where you're comfortable in knowing what works for you and what feels right.
Yeah. So after going through all the diagnostics, right, what did you learn that you didn't know before?
Oh, that's a great question. I think I learned a lot. I think the main thing I learned was that I'm in a pretty good place overall.
Good.
But I also think that there's so many more levels I can go to how I treat myself, how I take care of myself, but how I can be better in many ways of life. I think another thing I learned was that I'm turning 48 this month, and it's like no big deal.
Yeah.
I think that as a kid, thinking of these type of numbers was like, that's scary, that's old, that's, and I've never felt better, and I've never been kind of more excited about where I am right now. So I think that comes with just some like, maybe some mental and emotional maturity, which has been something that is newly learned.
Yeah. So you talk about all these different different layers and like the ways and things that you can dive into. What does that mean?
I think that, in what sense? And what layers of more fitness driven or more nutritional based?
Just health
or
in
more,
general. Like, I mean, thinking about the whole picture, right? Like, because everything that we're talking about is very holistic, right? And
Yep.
and thinking about the spirit, the vessel, and health, and all that stuff, right? Like, you've gotten to this place where you have done a bunch of diagnostics, have a lot of information about your body, right? And you're saying there's more you could do. What do you mean by that?
Oh, I think that maybe what I meant by that is that the ceiling is probably higher than I think it is. And I've always been a big dreamer. I never put any limitation on myself, but I think that watching myself perform now, and feeling how I feel is something that I'm like leaning into, but it keeps going further. I keep on having the ability to kind of push a little bit more.
I love that.
But rather than doing it all overnight, I'm like trying to improve in tiny bits here in many different ways all at once.
Yeah.
One of the big things one of the big changes in this whole, in all of lifestyle as a result of all this data is like, there isn't any one big change I've made.
Yeah.
It's like lots of tiny little adjustments, and then seeing how that works and making another tiny little adjustment, but little by, and then staying consistent and disciplined with that. In time, it becomes a big change.
Yeah. I love that.
There hasn't been any monumental sound the alarms, need to change this thing.
Yeah.
Some teeny little things all the time, and now they're really adding up.
And I love that. It's all about course correction, right? Like, it's not, you don't need to do an about face of the ship necessarily right now. It's about making, one, identifying what's the destination you want, and then slowly adjusting course to get there.
Yeah.
So you're in an interesting spot. We have a few other patients, clients at the Fountain that are in the same spot that you are, that have kind of done all of the diagnostics, right? Are doing a few different therapies with us on the back end. And the reason I really want to have this conversation with you today is really just understand like where you are and where you're at. And there are people, I think, outside of our facility as well that are in a place where they've done a lot of diagnostics. In our industry, do-it-yourself diagnostics. You go online for blood work, for genetic testing. You can go to a number of facilities to get the full body MRI. Like, it's all available at your fingertips, right? But what you do with it is really important as well. And as data and information stacks up, what we're finding is even under our own roof, right? You start to have conflicting priorities. I imagine you have a primary care physician you go see, maybe they have a different priority. Your cardiologist has a different priority. And it leaves our patients in this weird place where they're left to decide, whether it be by intuition, whether it's kind of, oh, I trust this guy the most, or Dr. AI told me this, right? We're left in a weird place as patients where we're deciding the best course of action without a real framework as to how to make that decision, right? So for somebody like yourself, we've talked about QLP, the Quantum Longevity Protocol, and what that is. And I'm not looking for a polished answer here. I'm really looking for you to give me honest feedback. Like, what hesitations do you have about jumping into a program like that? If you need me to explain anything, like, I can do that as well.
Yeah. I think that there isn't any sort of major, hang up or any major like roadblock in terms of why I haven't more deeply committed to getting into that. I think that that's more another one of these things where I'm resisting a little bit because it's a big change, or it's something that I've kind of like tried to convince myself that I don't have time to do in the moment. But it's one of these things where I don't want to do it only a little bit. It's a big commitment in time, money, things like that, where I want to be all the way ready for it and then go all in. And again, as I mentioned earlier, doing things a little bit is not for me.
Your style,
I don't spend a lot of time in the medical field when it comes to what you mentioned, whether it be a general practitioner or a cardiologist, things like that. I really don't. I do go, and not that this is right or wrong, it's just my philosophy for myself. And I don't suggest this for other people. It's what works for me. I kind of go by my intuition and how I feel. So I don't really see much, I don't really seek much medical intervention from like traditional doctors. Part of that is maybe luck of the draw that I haven't had anything major where I've needed that. But I've most of the time been able to kind of work through things on my own and nurse myself back to health in one way or another. So I haven't had a ton of intervention or involvement from the medical professional, other than, a broken bone or stitches, things like that.
Yeah, no, it's great. And it's a lot of people are, I was in that same position myself for a while. Like I haven't had any major medical issues pop up, like under, between imaging and genetics, like some stuff has popped up. Like, all right, I want to start getting ahead of that. But in terms of like, an acute issue right now, nothing really going on there. So I understand where you're coming from.
I think the greatness of the body scan for me was that I didn't learn anything particularly like earth-shattering new about myself, right? And that's what I was there for, right? I don't need that scan to tell you that my right shoulder's a little funky because I dislocated it when I was 20 years ago, or I have a little bit of lower back pain from too many years of pounding on it, that type of stuff. Sure. I didn't go there for that. I went to try to see if there was anything major going on that I wouldn't know about, or something that was happening inside of me that I would not be able to kind of diagnose on my own, or wouldn't know about till it was too late. So not finding anything out was kind of the big relief.
Yeah. Right? Is that what you got from the scan, relief?
I didn't have like the anticipation that something was going on, but just kind of checking that box, like, no, you're good.
Peace of mind.
Is truly peace of mind. Yeah.
Cool. Awesome.
Yeah. And that's kind of stuff that I've always done. I just want to stay on top of things, and kind of having the mindset that there isn't a problem unless there is one. I think one of the big things here is that there's all this stuff out there, but like everyone's on their own path. I don't think there's like someone who's going to sit in this chair and say, this is what you should do to somebody for somebody else. I think it's a kind of what is right for you. And I think that the way I live my life is probably, most people around me think I'm crazy with how disciplined I am or my behaviors and things like that. So that's not for everyone. But I think that do what works for you within what your ability and your commitment level is.
Yeah. Yeah. And that's fantastic. And it's funny, from where I'm sitting, I think the people that are looking at you like you're crazy are crazy. Because if you look at you, you don't look 48 years old. You look fantastic. Thanks. You're in great shape, and like you got everything going for you. So I think you're doing something right.
But I think that thank you for saying that, but I don't think that's for everyone.
Yeah.
I don't think that everyone's driven towards different things. Everyone's interests are different, and what is important to them might be different. So
I'm big at end of life, lying on my deathbed, looking back, hopefully having as few regrets as possible.
It's a beautiful way to look at it.
Right.
Beautiful. I have 2 small children, and not starting to have kids or go down this path till I was in my 40s was an interesting kind of path to take and decision making process to get here. But so much of that is like, number one, wanting longevity to be here to a ripe old age, hopefully, for them, but also having like the youthful energy to do all the things that are part of what I think is like a way to participate as a parent.
Yeah, it takes a lot, man.
Kids.
It requires a lot of energy.
It's a young person's game. So we need to have that kind of energy. The other side of it is, for me anyway, everyone's different, is leading by example, right? I'd like to set the kind of example that my family and my kids around me see and say, hey, if I turned out like that, it wouldn't be so bad.
Yeah.
And so much of that is like what they absorb by the behaviors that they witness or that they're around, the environment that they're in. So we try at home to be as loving as possible and respectful as possible, and all these things so they think that's normal and that's the way it should be.
That's great.
So yeah, a lot of it has to do with just trying to, be the best versions of ourselves as an example for them.
So something you touched on a second ago, and that's fantastic, by the way, something you touched on a second ago though, that I want to dive into a little bit deeper. You as a consumer, right, see things a lot differently than I do. Specifically in longevity, right? And you're talking about it's tough to discern like what to do, what not to do. There's all these different things out there and available. I was talking about earlier today, a kind of dark side of our industry has turned into utilizing, almost weaponizing diagnostic data against patients to convince them they need all these things that they maybe don't. In general, right? What do you think about that statement? Do you feel like that's something you've seen, and maybe with us, maybe, and hopefully not with us, but with us elsewhere? Do you think that's a fair statement? Do you see that happening?
I can't speak to that happening in your space because my only experience really in this space is with you and
Got
in
it.
your operation, which has been wonderful. But I have experienced that in many other places in life.
Yeah.
Um, I went to the dentist yesterday for a cleaning,
Yeah.
and I am a very frequent dental customer.
Yeah.
I subscribe to them more 3 or 4 times a year than 2, just because it's comfortable for me. And I have a couple of small fillings in my teeth, but I've never had a cavity.
Mhm.
And I give you that example because there was a place that we used to go to in Tribeca that was like you walk in the door and they were pounding you with upselling things, but it was so much. The ethos of it was driven by fear,
Yeah.
and it was, well, you have the start of a cavity, and if you don't do it right now, the next time you come, it's gonna be worse, and then you get this little filling or this thing, and it was the extra $1,000 or 500, whatever the thing was, and there was so much of that, and it was like it was all driven by fear, and almost putting the blame on you. If you don't do this, then
Yeah.
we can't help you later, or it's going to be much worse later. So I think we experience that as a consumer in lots of places in life. But I think in anything in life, there's going to be some percentage of bad apples in any business. I'm in the insurance business.
Yeah.
There's probably bad guys in my industry, and there's bad guys in every industry. Unfortunately,
Yeah.
the people that have that experience maybe relate that thing, their experience to that industry or that place. So I've never had any negative interactions in your space, in your industry at all.
And it's a slippery slope, right? And like in any industry, it can be either subtle or egregious. And I look at, like, let's use dentistry, for example. Like, I imagine nothing they're suggesting they're doing is going to hurt you, right? But are you actually getting any benefit from it? That's the
Right.
real question. And we experience that. And I think it's more of a nature of the business model of most longevity clinics like ours, where the clinic benefits not from a program that you enroll into, but being motivated and compensated by selling you a solution on the back end, whether it be therapeutic, supplements, et cetera. Right. And so it's like you then are put in this weird place as a facility where, okay, Michael's sitting here. He has all these things showing up on his blood work. We have things that can address all of those things. Does he need all of them? We're not really sure. And most facilities aren't really sure. Like, does he need everything? But it's this approach of like, let's throw everything at the wall and see what sticks. And if it all works, it's great. Now, that's probably the more conservative approach. Then there's the places that are like, hey, we know he doesn't need this, this, and this, but we're just going to sell him everything because Mike's a successful guy and he has money and we're good. So it's really what motivated us to, and me specifically, I've always been big on aligning what's best for the business and what's best for the consumer, and recognize early on that model's not it, right? Because it puts everybody in a weird decision where now you're questioning, right? And you sit at the dentist's office, you're questioning like, wait, is this something I really need? Or they're just trying to make money off of my teeth, right? And it's the same thing in our industry. So by creating QLP and having it be a program that somebody enrolls in, and having it be one competent enough system, but also a system that rewards restraint just as much as it does action, gives me comfort knowing that, hey, like we're now putting people on a program where anything that's suggested is necessary. And of course, it's not going to do any harm, but there's no need for us at this point, even from a business standpoint, to like, hey, I don't need to upsell Mike on X, Y, and Z, because as a business, him enrolling in the program is where most of our money is coming from regardless. Now, all this stuff, like, yeah, if there's appropriate therapies in the back end, we still make money off of that. That's great. But we don't need that to survive and thrive. So
What's interesting about that is maybe it kind of comes all the way full circle about where we started this conversation, which was I've been coming to see you guys for a few years now, and little by little we've kind of ramped up and done more and more things and expanded. Maybe that's the process for me anyway. Maybe it was start small, understand, develop trust, see what's working, and add as you go. And maybe that's a comfortable path for some people where rather than getting kind of whacked over the head with 10 things at once the first time you walk in the door is a process. For me, that was the initial kind of that process worked for me. I also think that when we started a few years ago, there was maybe less things available at our fingertips, and all of the different therapies and peptides and all that stuff was not as widespread as it is now. And there wasn't so much of it going on, or maybe it wasn't so kind of mainstream. So, that's a process that worked for me, just to kind of get here over time.
Yeah, because I would love as a business to do nothing but QLP, right? And obviously inside of that, it exists all the diagnostics, all the therapeutics, all the relationships. But the honest truth is like, not everybody's there yet. I think
Right.
everybody in the longevity space as a patient is heading towards the problem that QLP solves, which is too much information and conflicting expert opinions. But recognizing that everybody's there yet, like we had some learning to do early on where I was just going right at people like, hey, I'm super passionate about it.
Yeah.
Like, this is a great program. Like I've seen what it's done for me. I've seen what it's done for the few people we've enrolled. Like you need this. And people are like, whoa, I'm just asking questions about peptides, dude. And so we learned, I learned very quickly, like you have to kind of meet people where they're at and allow them to grow within your ecosystem, but also have the ability to grow with them. Cause a lot of these places you go to, it's like you go, I don't want to name any specific facilities, but it's like they do one thing and it's kind of this blanket approach. Like, all right, everybody that comes in is getting this. So that's what we do. And it's like, well, not everybody comes in needs that, but in order for their business to survive, it's just this cookie cutter model of like, here's what you get. And for us, that didn't work. So we're trying to meet people where they're at, allow them to grow with us. And it sounds like that's kind of the experience you've had.
Yeah. Well, wouldn't you say that the space you're in is the complete opposite of a one size fits all? Like every person that walks in the doors needs, wants, desires, things are all different. So to have that kind of model, almost like a subscription model where you walk in the door and this is it, you're plugged into a box. It's like, we're all different size, shape, needs. I think that the one size fits all is really, really hard to do.
I had this conversation earlier, like it's the customization and personalization is very tough to scale. And so it's why a lot of these bigger businesses have got into all right, here's the model, it's cookie cutter. And like, yeah, there's certainly a patient that's appropriate for, but they get sucked into trying to like force that on every person that walks in the door. And some people that really don't need it end up subscribing to it. And I think that's exactly what our industry is experiencing, but exactly why everybody's going right. We're trying to go left to make it super personalized. And then ultimately take it a step farther with the diagnostics and then take it a step farther on that of like, let's actually address the big issue, which is again, all the data, conflicting expert opinions, and let's put some decision governance around this, which I think is going to work out great.
Fair.
Yeah. So to wrap up, I want to give you a series of rapid fire questions.
Okay.
They're just very simple, couple words, couple sentences. And then we'll hop on to the next. We got 5 of them. What is the most surprising thing you have learned about your health since starting with us?
I've learned that despite where I think I am, there's always a lot of room for improvement.
It's really cool. I really, that's a unique answer that I haven't gotten before. And I think it's awesome. Did going deeper make things simpler or more complex?
Both.
Okay.
Both. It made the plan simpler. Learning all this stuff made it easy to make a plan. But the plan is more work and more difficult and more complex.
Sure. Okay. What do you feel most confident about now?
It's something I'm going to repeat with something I said before. It's about turning 48 years old this month.
It's awesome, man.
Yeah, definitely.
Happy birthday.
Thank you. We got 2 weeks. So hopefully I make it.
We'll assume you're going to. What are you still unsure about?
I'm unsure about, I believe I'm unsure about how far I can go. I think that each day is the furthest I've been in this process and with myself. And so every step you take is the furthest you've ever been away from where you were. So yeah, I think that's the thing. I think I'm unsure about how far I can go and where I may be content and find that like kind of zone of where I want to stay.
You think you'll ever stop? You think you'll ever?
No.
Yeah.
I know myself.
I want to.
Definitely not. Well, for me, like the journey is the whole thing. There is no destination for me and anything in life. And
I love that.
The chase is always what I'm excited about. And when I get to the thing, it's like,
what's next?
And it's also that thing is like, it's not stimulating. It was the experience to get to there. That was the thing.
I love that.
And then the thing itself is just kind of in the way of continuing on the path to get to the next thing.
I love it, man.
Yeah. Yeah.
Any questions for me?
No. I think that this kind of bringing the health and the data into like how we feel and how we perform physically has like been the great marrying of things that historically have been separate for me. Yeah. Right. There's been this the side of life that's like fitness driven, the side of life that's like your nutrition and behavior and then this side of life where it's like your medical intervention, and that's all been these different silos where for me now it's all finally one homogenous thing that all should be in communication with each other and should be working together. Otherwise, we're at the same thing like you mentioned before with all these different doctors. You pulled in different directions because the thing that you're doing at the gym is not working with what your medical treatments are, whatever the things are.
Yeah.
I think having this all be one kind of cohesive thing is the big thing.
I agree. And it's, it almost seems like the physical side becomes spiritual at some point. You talked about the spiritual journeys that you've been on, and you and I have had a lot of discussions about that. And it's interesting that it's like I said, it's all aligned. It all ties together. Would you say that's fair?
Absolutely.
Yeah.
It's all connected. And the more we can kind of connect them, I feel like that's when we're the most in harmony with ourselves.
Yeah.
Right. And in alignment. But yeah, it's a wild ride we're all on together.
Well, I appreciate you being here
Thanks for
today, and
having
I'm
me.
happy to be on that ride with you.
Yeah.
Thanks, Mike.
Thanks for all your help.
Sweet.